Thank you for finding the time to join us. My name is Marie Yambo. Now, every hour, 57 people die in Kenya, but with a working emergency healthcare system, this number could be cut into half. So what are the challenges facing emergency healthcare in the country? Well, to answer that question is Dr. Benjamin Wachira, an assistant professor of emergency medicine at the Aga Khan University and with the Emergency Medicine Kenya Foundation. Well, welcome to the program, Dr.
Thank you very much.
Well, later on in the program, Dr. Wachira will also be showing us how to help someone who has collapsed suddenly. So you want to stay tuned to learn more about that. So, Dr. Wachira, just as we've rightly introduced the program, you know, emergency medicine, 57 people dying every day in Kenya, or every hour for that matter, and just with the working system in terms of emergency healthcare, that those deaths can actually be halved or up to 50%. So what are some of the challenges then that we're facing?
Yeah, thank you very much. I think the biggest issue we have right now is we have no system. Okay, we may have the different components of the system. You have an ambulance here, you have a hospital here, you have healthcare providers here, but there is no entire system that has been created around emergency response. And similarly, we don't even have a number to call in case of an emergency. So there's still a lot of gaps in terms of that connectedness of the system that will ensure survival of people who are having emergencies.
Okay. You know, I started with that question because it was in our introduction. But just before we get into the challenges and the national number that people can call and all that, make us understand what is the difference between, emergency healthcare professionals. How do they differ from medical doctors?
Okay,
yes.
So there's a big assumption that healthcare providers are trained to handle emergencies. But same way that as we go through medical school, and whether you're a doctor, nurse, clinical officer, you go through all aspects of healthcare in terms of training in your medical knowledge. But there is that aspect of emergency care that's not comprehensively taught in medical training colleges because it's a subspecialty. It's something, for example, even surgeons go back to school to learn surgery. Pediatricians go back to school to learn pediatrics. So similarly, whether you're a nurse, doctor, clinical officer, you need to go back to school to learn emergency care. So as a country, we've never really focused on postgraduate training of emergency medical care. And even then, the graduate training that's currently provided is not sufficient to ensure we have trained healthcare providers in the system.
Okay. You know, it's very interesting because there's that assumption that if you're a doctor, and especially a doctor of human medicine, you should be able to perform emergency care at any point.
Yes.
So there's that misconception.
Yes.
Now, could you just give us a sneak peek, if I may call it? What is it that is so special about this particular training that the doctors don't really have, in their normal training?
So emergency care or emergency medicine is a care provided to a patient who's suffering from acute illness or injury that if not provided in a timely manner, then the patient will either die or have a prolonged hospital stay or suffer complications of their injuries or illnesses. So there is a lot of aspects of acute care, and that's why for emergency healthcare providers, they're like jack of all trades, because you need to learn emergencies in mental health, you need to learn emergencies in surgery, you need to learn emergencies in obstetrics. So it's not just focused on one, and you also need to learn emergencies covering the entire spectrum of the human life, from the baby all the way to the old person. So it's not just looking at babies only or adults only. So it's very comprehensive, but it's also just focused on that initial care that a patient requires. So we normally work a lot with the internal, the hospital doctors who now will admit the patient, or ICU or critical care doctors will admit the patient and continue the care. But for us, it's providing that initial care. And this initial care also extends to the pre-hospital environment. So there are also pre-hospital healthcare providers who are trained to handle roadside emergencies, to handle emergencies when they come to your house and let's say someone has collapsed in your house. So they're trained specifically to be able to provide that kind of care in a pre-hospital setting or in an emergency department setting. And then once you're stable, then of course, then we'll either admit you or either to the wards, the critical care, or sometimes we'll actually be able to stabilize you well enough for you to for us to send you home.
Okay.
Yeah.
Okay.
Yeah.
So, you know, it's also enshrined in our constitution.
Yes.
The right to emergency treatment
Yes.
is actually in the constitution. But we've seen cases where Kenyans have arrived at a hospital and either there have been complaints of not getting the treatment right away. Sometimes probably they're even being charged for it and all that. So I don't know, what is the duration that a patient should actually wait in an emergency
Yes.
case?
Well, there are different perspectives to look at this. So I like the part that you said, yes, our legislation around emergency care is really good. The Ministry of Health actually launched the Kenya Emergency Medical Care Policy in 2021. The Health Act 2017, Constitution 2010, all have that right to emergency medical treatment. Now, the big thing that has not really been well defined is, number one, not every hospital has the capacity to handle emergencies because they need the appropriate resources in terms of infrastructure, they need the appropriate trained personnel working in the emergency department. And then, of course, as you mentioned, the whole issue of, yes, the law does say that if you present an emergency, you are supposed to get care regardless of your ability to pay, but the law has not, or they've not actually defined, so who's going to cater for these bills later? And yes, of course, it's a matter of life and death, and many institutions are actually providing that emergency care. But at some point, the discussion then comes into who's going to be catering for all these emergencies that they are providing and not being reimbursed.
Not every hospital has the capacity to handle an emergency.
Yes.
So where or what kind of hospitals should actually somebody go to first? Because if we remember the story of the child who had the fork jembe stuck in the head, they'd actually gone to several hospitals instead of going straight, say, to Kenyatta National Hospital.
And that's where the whole system comes in, because we have, I think, thousands of healthcare facilities in the country. But if you look at it from a public perspective, the facilities that, so the first part of it is any facility that is open 24/7 and has a functioning theater, because also you should be able to cater for surgical emergencies, has the capability to provide emergency services. Now, if you're looking at it from the perspective of public hospitals, and we're talking about level 4, 5, and 6 hospitals, and similarly in the private setting. But beyond the classification of the size of hospital and the availability, there's need for that purposeful design of the emergency department, the resources of the emergency department, and the infrastructure around the emergency department. And one of the projects we did initially some years back was to go around the country and map which are these facilities that already have the starting infrastructure, let me put it that way, but then they all need to still be scaled up in terms of available resources, well-defined emergency departments, clear protocols for emergency care. And that's why, for example, when you talk about the child, the public doesn't know where to go. And that's why you need to have an ambulance service, because the ambulance would know where to take you. You, when you're driving in your car, you'll just go to the nearest hospital, because you know imeandikwa hospitali. You will rush there. But that may not necessarily be the best place for you at that particular point. And the problem is, because it's an emergency, you moving from hospital to hospital to hospital actually increases your chances of dying and increases your chance of getting complications. And that's why, if you, in a proper system, ideally, you'd either call a number and they'd tell you, based on what you're saying, you need to go to this specific hospital, because there they know you'll be able to receive the care you need. Or if you call an ambulance, and the ambulance will, based on what you're suffering from, take you to a hospital that is already ready to care for you that way. So the situation we find ourselves is hospital shopping, and not necessarily because of anything, just because you went to a hospital that is not catered to be an emergency center, does not have the facilities or the trained personnel, and unfortunately now you're the one who then has to keep moving, because we've not really defined the entire system.
Yeah, exactly. Lack of awareness again.
Yeah.
Now, we are dealing with the special situation at this moment. When you talk about emergency, healthcare, people rarely think about drought and its effects. So at the moment you're dealing with drought as a country, what are some of the emergency or crisis that we are likely to see or we're already witnessing? Actually,
it's the whole heat. Okay, so I know we look at it from drought from the perspective of lack of water, and of course there's a lot of dehydration happening, especially in the arid and semi-arid areas where people are dying because they can't access water. But on the other aspect of it is also looking at people who are, let's say, immobilized. For example, the elderly in their homes. Because of the heat, they're not able to walk and go look for water. So you get a lot of heat illnesses where people are dehydrating a lot and not being able to keep up with the water losses that they have and drinking.
Yeah. Yeah. Now, COVID-19.
Yes.
I know we are, is it about 2 years past since COVID-19? But what are some of the learnings that we got from COVID-19? What are the gaps that COVID-19 actually, exposed in terms of emergency?
Actually, I think COVID-19 really highlighted the gaps we have as a country for emergency care. I remember, I'm sure you may have seen it in the media and know people who are driving from hospital to hospital looking for a bed, for example, looking for critical care service or emergency services, or looking for an ambulance to come pick you up. So the need for emergency care was really brought up by COVID because we needed a lot of ambulances, patients needed to be put on ventilators, so we need more ICU beds. People are getting to a hospital, but the department is so full that they cannot accept you anymore. Yeah. So I think, and oxygen, for example, those people could not access oxygen. And all of these are more or less emergency services and emergency resources. So I think from that experience, I think we needed to learn from that and look at how do we build our system to cater for these patients. Even just looking at it from a COVID perspective, how do you call, if you have COVID and you have a house and you've collapsed, where are you going? Who are you calling? So the same way even COVID, not every hospital was taking care of COVID.
Exactly.
Yeah, there were very specific hospitals that were taking, and it's the same hospitals even now would be taking care of emergency cases because they already have the infrastructure. Well, they have parts of the infrastructure and the resources, but there's definitely need for us to define this properly, for even the layperson to know this is an emergency center, this is not an emergency center. Yeah, exactly. This is where I go in an emergency, this is not where I go in an emergency. So from the learnings that we had in COVID, we really need to be able to now look at defining this system properly, being able to make it aware for the public to know. Because again, sometimes maybe you will drive yourself to the hospital. So you also need to know where to go, not so that you're not driving around like what used to happen. Yes.
Exactly. Now, emergency care is something that we all should be concerned about. Take a listen to some of the questions that Dr. Wachira will be responding to from members of the public.
I'm Wangare Washiri. So with these emergency doctors, when they themselves have their own emergency, like not related to like the hospital, how do they manage to put that aside or their own problems aside and handle the emergency that has come at that particular point, Yeah, so how are they just able to do that, put their lives aside and focus on this emergency that is there right now?
My name is Victor Mburu, and my question is concerning the ambulance, and I would like to know what are the features within an ambulance that makes it to be the best mode of transport when transporting sick people, or in case of an accident, why is it the best mode of transport when transporting the patients?
I'm John Mwangi, and my question is this. Since we Kenyans, we are the first ones to respond to an emergency, how are we supposed to respond since we don't have those emergency kits? Maybe some of us are not informed on how to handle that emergency. So what I would really like to ask is, how should we respond to that emergency?
My name is Sela Onyango, and I have a question. There is this trend going on in our roads, like when Kenyans, they listen to the siren from the ambulance, they don't give way. Even the train drivers, they don't give way. And sometimes it's carrying a sick person, maybe somebody who has been injured from an accident, and they don't give way. So how can we just talk to Kenyans so that they can know that they can give way to our ambulances. And again, what is the worst that can happen now that they're not giving way to the ambulance?
Very nice questions from the public, and I'm happy to see the public are concerned about emergencies. So to the first question about how do I deal, because as I'm an emergency care provider, how do I deal with personal emergencies? And to be honest, and I'll use the example, I mean, my dad was sick last year, and he was having emergencies. I call an ambulance. I call an ambulance because sometimes emotions cloud you and cloud your judgment as a healthcare provider, even especially where it's someone you know you're related to. And so for me, it's always, let's get an ambulance, let's get to the emergency department. Within the emergency department, then I'm able to consult with my colleagues. So they're able to check me. So I may know what to do, but I am not, this is my father for this particular case. So in that situation, then I will listen to their advice on what's the best way forward, and we can discuss. So I always call an ambulance. I don't even try to, I mean, there are emergencies that may not wait for an ambulance, and potentially I will act on them. But most of it, I call an ambulance. Let's go to the emergency department. Let's deal with this as a group with other healthcare providers. On the issue of what is special about an ambulance, so a well-kitted ambulance actually has the same resources as an emergency department, and in some instances, the same resources as an ICU. So there is specialized emergency care equipment that is available in ambulances that is able to be deployed by the trained providers who are inside the ambulance in your house. In proper settings, you don't need to be taken to the hospital first. They will actually provide all the care for you in your house, on the street, and you're just not being taken to the hospital, maybe to be admitted, and then further tests and investigations. So a well-kitted ambulance has trained personnel and has equipment that is life-saving, that is available to be deployed. And that's why we always say emergency care goes to the patients. Patients don't come to emergency care because emergencies don't happen when you show up in the emergency department. Emergencies happen in the house, in the community. So the ambulance has the resources to come and provide that initial stabilization wherever you are. But this is, of course, a well-kitted ambulance with trained personnel inside the ambulance. On the issue of what the public needs to know, everyone must learn first aid, okay? And why we insist on this is because there are some emergencies that even if we had the best system, the ambulance will not get to you on time, okay? Even if we say it's a 5 minutes. For example, if I was choking right now, and yes, we can say there's an ambulance down the road. By the time that ambulance comes here, I'll be dead. But you knowing first aid will save my life with simple maneuvers that by the time the ambulance gets here, I'll be alive.
I would like us to do the CPR demonstration. You know, cardiopulmonary resuscitation is a life-saving technique that is useful in many emergencies, such as heart attack or near drowning. Well, Dr. Wachira is just about to be demonstrating to us how to go about performing a CPR, you know, on a patient who has just collapsed. So we can have that demonstration right now.
So the first thing is when someone suddenly collapses and is not breathing or is not breathing normally, then the first thing, of course, is you need to ensure scene safety to make sure you don't also become a casualty. So you cannot start CPR in the middle of the highway.
Exactly.
Yeah, so you need to make sure that the scene is safe. Next thing is you need to call for help immediately. Tell someone to come and, so if you're alone, you'll have to go call for help first, then you come back and start CPR. If you're not alone, then you can send someone to be calling for an ambulance because you need that response to be on the way as you start helping, okay? So in the person who's suddenly collapsed, essentially what you need to do is kneel beside them, okay? All right? And this is what we call hands-only CPR, okay? So very simply put is you interlock your fingers, okay? And then in between, at the center of the chest, we normally call it in between the nipples, so just at the center of the chest, then you need to put your hands on that, okay? Make sure your shoulders are parallel to the center of the patient's chest, and then you're just pushing down 1 and 2 and 3 and 4 and 5 and 6, okay? At least 5 centimeters of compression, okay? And you need to do this continuously, okay? Continuously, not too fast, not too slow, okay? A nice bit, you can always say 1 and 2 and 3 and 4 and 5, okay?
Yes.
All right? And it can get quite tiring, and that's why you need to call for help so that other people can come and help you. And ideally, we recommend that you do at least 2 minutes of this.
Continuously?
Yes, continuously, or 100 to 120 compressions. And then immediately you're tired, then somebody else comes and continues. And you need to continue this until the ambulance services come to you.
Okay, so even if the person regains consciousness.
If they regain consciousness and now they're talking to you, then of course you can stop, okay? But sometimes this may not be apparent to you. And that's why we always say, if you're not sure, just continue CPR, okay? When the trained healthcare providers come, then they'll be able to assess the patient and see if there are signs of life or not.
Okay.
So if someone suddenly collapses and they're not breathing, remember, they're not breathing when they're not breathing normally, that's when you start CPR. If the person has fainted, and they're breathing, and you can see they're breathing, then you don't need to start CPR.
Okay.
But in a situation where they've collapsed and not breathing or not breathing normally,
You have to
start CPR.
yeah,
Call for help.
yeah.
So make sure the scene is safe. Call for help. Start CPR.
Okay. Now, what does a CPR do?
So essentially, what has happened is your heart has stopped or has gone into a rhythm that is not pumping blood. Yes. Remember, your key organs in the body are your heart, your brain, okay? That's the key main ones. So what you're trying to do now is, because there's a big bone over here and there's your back, you're trying to pump the heart, okay? To help blood flow to the head and through the heart, to the head and through the heart, because you're trying to keep that flowing and to keep the perfusion, what you call perfusion or blood flow through the brain and the heart, because we need to keep these organs alive. It takes only up to even 4 minutes with no blood flow for them to die.
So here is a case, as we had put it initially. We do not have an emergency hotline. So if you ask me today, how do you get an ambulance? I probably will tell you, okay, I might Google or something like that. But there is an app that you've developed. And this can actually help people, not just to learn the CPR that actually first aid for that matter, because remember one of the questions asked is, how can Kenyans learn first aid? So maybe you could take us through how this app works.
So the Casualty App is an app we designed that is supposed to support the general public and healthcare providers to provide emergency care. So as a general public, essentially what you need to do is download the app. You can get it on the Google Play Store or the App Store and just go through the registration process. Make sure you choose, if you're a general public, make sure you choose general public. If you're a healthcare provider, choose a healthcare provider. For the general public, so the common features of the app is, number one is emergency assistance. Remember I told you, you need to call for help. We do not have a single emergency public ambulance access number.
Yes.
With devolution of healthcare, then the county governments are responsible for providing ambulance services. So what we've done is, if you click on emergency assistance, for example, on this, then you have different ambulance numbers. You have NHIF ambulance numbers that you can call.
Yes.
You have different county ambulances. For the counties that have already set up their ambulance services, you actually have the numbers to the county ambulances. And you can call these numbers within your county. And then if you're looking at private ambulances, you can either call private ambulances, but we've also put other emergency numbers. For example, you had talked about snake bites earlier in our conversation. So there's a snake bite hotline. We know mental health is a big issue, so there's actually a suicide hotline available on the app. You can also call police. There's a rape and gender-based violence hotline that you can also call through the app. So under poisons, of course, the poisons hotline for you in case someone has taken some poison. You can call these numbers. And then in the app also, then there's a whole tab for first aid. And of course,
can see it here.
so once you've called for help, if you have someone within that you're with, then and they're able to quickly access the app, they can read quickly how to do something. And there are clear step-by-step instructions on what to do. Because I remember from the question about what do I do as a general public? So this provides you, you can read it before. I'd advise you to learn the first aid before, and you can learn it from the phone anytime.
I'm actually seeing cardiopulmonary in children,
exactly.
in babies, what we were just demonstrating.
Exactly. And we've actually put in LinkedIn videos. So if you click on there's a YouTube channel thing. If you click on it, it takes you directly to the video for you to be able to see how to do the procedure practically by video. So it has all common emergencies, choking,
eye injuries, burns, stroke,
fainting, shock, fits or seizures, stings, bites. So you can go through all that, and it has step-by-step guide and videos. So we encourage the public to download the app and learn the first aid by themselves. Okay, of course, it's good to go to a classroom to learn, but as you said, like you're a busy professional. As you're scrolling social media, you can also just scroll through the different first aid
and
learn.
as you mentioned that they have videos, you might just be able to save a situation.
Exactly. So as the ambulance is coming, you can quickly see the videos. And these are short videos. They take less 1-2 minute videos. You can see quickly what to do and then practice on someone. What we've also added in is finding the right emergency center. So this is a project we did with Google, that we went around the whole country to map out all the public emergency centers in the country and private, and created a map. So you can actually see with the map in, and if your location is on,
locate emergency center. I can see it.
Exactly. So you're able to see. So the ones in red are public. Emergency centers. The ones in green are private emergency centers.
In about 2 seconds.
Yes.
Just take your time. I don't know, your last parting shot for Kenyans.
Emergencies affect all of us equally. Whether you're a politician, a poor person, a rich person, doesn't matter. We all face emergencies every day in our lives, or someone we love. And if we take that extra step to learn what to do in case of an emergency, we could be the heroes for these people, and we could actually save a lot of Kenyans' lives as we work to build an emergency healthcare system in the country.
Thank you so much, Dr. Wachira. This was a very, very informative session in as far as emergency care is concerned in the country. And I hope you've also learnt a lot. And, you might just be the person to save that person's life. So thank you so much for tuning in. In case you missed any part of the program today, do visit our YouTube channel or Facebook, that is KBC TV, KBC Channel 1 TV, that is. We'll be able to see you next time. So my name is Maria Ambo. Until next time, do have a great evening.